to be put on the record.
Cider that have been donated by their store, and then the theater also has their things too. So there's a variety of things you can drink. We've got soft drinks in the cooler right behind you all, and feel free to get something to eat. Here in a few minutes we'll start, and then the bar will close during that, and we'll maybe take a little break in the middle so you can open it up and everybody can grab another drink or something, and then we'll go back to it. Welcome. Thank you for coming.
Maybe I'll do that for when I introduce you, that way no, it's not working. I'm going to have to go
So let's call this a 5-minute warning. Yes. Grab a beer, go to
Let me know when it's 6:30. We'll give everybody a 5-minute break to go get another beer.
Thank you all for coming. I realize that the gorgeous, like probably one of the best days in the sun, right? Not too hot, and it's sunny. So I realize you're giving up a gorgeous afternoon, evening to be here. But I think anybody who's walked in the door recognizes that what we're going to talk about tonight is probably one of the most devastating issues that faces our society and is hugely intersectional. There are so many aspects of it, so many things that cause it, so many things that continue to make it worse. So we have a panel of people who are experts in a variety of different ways around this topic. And my hope tonight is that when we're done, everyone will go away with a deeper sense
of the kinds of things that we need to address, and we'll spread the word. We'll talk to their friends. Hopefully a lot of folks will see it online, because we are going to have to make some very big moves in our society to solve this problem. We clearly have not been for a very long time. So sit back, buckle up, enjoy. We will have, at some point tonight, we will have questions from the audience. I had a cordless mic, it's dead, so you're going to have to be like me and use your outdoor voice and enunciate, which I'm not great at either. So, for starters, I want to introduce our amazing panel, who have all chosen to be in an order not on my page. So, use the mic so I can do a better job. Sorry. Okay. Sorry. All right. Starting at that end, Kevin Fitz is the Executive Director of Oregon Mental Health and Consumer Association. In addition to his responsibilities as Executive Director of the Oregon Mental Health Consumers Association, Kevin serves on the State of Oregon Consumer Advisory Council, State of Oregon Addictions and Mental Health Planning Advisory Committee, Unity Center for Behavioral Health Advisory Committee, Multnomah County Adult Mental Health and Substance Abuse Advisory Council Executive Committee, and a Home for Everyone Coordinating Council. His first experience in the mental health field occurred when he was a patient, involuntarily committed to Sanish State Hospital at 19 years old, after experiencing a few years of instability, including extreme states, hospitalizations, homelessness, trauma, substance use problems, and other difficulties. Kevin found peer support and developed ways to cope with his challenges with self-care, especially self-management of diet, exercise, and sleep. Kevin eventually started using his lived experience to help others while working at Mind Empower, Inc., a peer-run drop-in center, and his communication and leadership skills grew. He was honored to receive Governor Kitzhaber's Disability Leadership Award in 1999. His work also received national recognition when he was selected to serve on the National Advisory Council Subcommittee on Consumer Survivor Issues for the federal agency SAMHSA from 1998 to 2002. His current position as Executive Director of the OMHCA. He still lives with disability challenges, but directs his energy towards policy behind state-of-the-art long-term rehabilitation, peer support, peer mentoring, and the role of technology tools for empowering individuals living with disabilities and different abilities. Please welcome him. Next, we have Kaia. She became the Executive Director of Street Roots in 2017, 2 decades after she worked as a staff reporter for the Burnside Catalog, the predecessor to Street Roots. In those subsequent 20 years, Sam worked as a poet, artist, community organizer, and university professor, focusing particularly on economic injustices and homelessness. From a magic show she created about financial collapse to the Right to Survive Ambassador Program, she co-founded for housed people to learn from people experiencing homelessness. She taught at Portland State University, Pacific University, Willamette University, and St. Mary's College in Maryland. In 2019, she was awarded the Spirit of Portland Award by Commissioner Joan Hardesty, and in 2019, the Regional Society of Professional Journalists Small Newsroom First Prize for Best Column. Alli Sayre is a union organizer and member of Portland's Tenants United organizing committee. said that already. She previously worked for 7 years as an EMT, primarily in Clackamas County's 911 system, and was a rank and file member of Teamsters Local 223. She has a great sense of humor, which you're not for. She's extremely talented at organizing workers, but her focus is on arguments with people online for very long periods. In some cases, where the alleged grievance has ceased to live on God's green earth. She also enjoys super games, where she is an expert at diagnosing enemy team injuries from over 500 feet without the All right, please welcome Alli. Dr. Richard Bruno is a family and preventative medicine physician. He is double-boarded family preventative medicine physician, serving as senior medical director for primary care at Central City Concern, a federally qualified health center that focuses on health care for the homeless in Portland, Oregon. His main clinical focuses are on addiction and diet-related diseases, with involvement in community public health interventions and policies, including cooking classes for kids and legislation expanding access to medications for opioid use disorder. He has served on the boards of national, state, and local organizations, including the Committee to Protect Healthcare, the Oregon Chapter of Physicians for Social Responsibility, the Oregon Prescription Drug Affordability Board, the Richmond Neighborhood Association, and People's Food Co-op. He attained a bachelor's degree from Princeton University, Doctor of Medicine from Oregon Health and Science University, and a Master of Public Health from Johns Hopkins Bloomberg School of Public Health. He graduated in the Combined Family and Preventive Medicine Residency Program at MedStar Franklin Square in Johns Hopkins in Baltimore. His wife and 2 children, it sounds like without him, enjoy hiking. That's what they're doing right now. So please welcome Dr. All right, so to set the stage a little bit, somebody online, Lloyd Rivola, Lloyd here tonight? So then he's online watching. He asked for questions, and he gave us one that was so good, I thought this was a great way to kick off the whole evening. It says, as a dedicated supporter of street roots and similar activist communities, I'm looking for an update on the need for expanding the general appeal of broad-based radical solutions to counter the mere frustration and impatience that too many Portlanders seem to cling to reactively, year after year, as regards the challenge of houselessness and street litter, issues which in fact have been gripping the city for a decade, if not since the Great Recession. So we're not asking that as a question at this moment, but I think that's the question. If we hold that in our mind for the rest of the evening, it really gets to the core of what we're talking about. There's a lot of folks out there that see the homeless as a nuisance. They see them as dangerous. They see them as destroying their city. And yet, this is something that our society has done. This is something our society has done. We have caused this. So, this should be a great evening. I'll give you guys back your mic, and then I will start asking questions. So, to start with, Kaia, do you have a sense of what percentage of the population is paying more than 50% of their income for housing?
Yeah, thank you for having us. It's really nice to see all of you out here tonight. I think that question is really powerful in the sense that it widens the pool, right? This is all of our problem. And so we have visible street homelessness. We have people who are living homeless in all kinds of situations that aren't visible. And then we have precarious housing situations. So the latest numbers I read in Oregon with the Housing Authority were that about 50% of the population is spending more than a third of their income on housing, and 27% of what you're talking about. 27%, so nearly a third of the state spends more than half their income on housing. And a couple things when I think about those numbers. One is that sometimes people are able to maintain housing, but that means that they're foregoing medicine, they're foregoing nutritious food, they're foregoing a lot of things that impair their lives dramatically, or they're on the precipice of being evicted. And like I'm sure Alli can speak to this, but the numbers just keep going up in terms of evictions. We have a reporter at Street Roots, Piper McDaniel. Give her a shout out because her reporting is fantastic. She just reported on just the climb of evictions month after month after month right now. So I think statewide last month there were about 1,400 evictions, and the majority of those were for inability to pay.
Yeah, and that's not something that, oh my God, that's really bad right now, and we should fix that. This is a trend. This is a point in a trend that we're seeing. It's getting worse year over year. So those folks that are sitting on that edge, imagine what life was like for them when COVID hit, when they lost their job, or maybe one of the people in the household lost their job. They had half the income they had before. This is so, yeah. Alli, how long have wage increases not kept up with increased housing costs, and do you see any change in that trend in the foreseeable future?
That's a great question. I think it's a very complicated question to answer because right now, since the pandemic, we've seen, when it comes to lower income workers, significant increases in wages, and that have potentially surpassed the increases in housing costs, but ultimately they couldn't afford housing before the pandemic, and so until we actually, address, the cost of housing, and folks have, the security and actual, guaranteed wage increases that meet or exceed the cost of living, they're never going to actually get to a point where they can afford it. So, we saw, in the Portland area in the past year, on average, rent's gone up about 8%. Inflation is higher than that. Wages have gone up 5.7%. That's overall for lower income workers, it's higher. But I think these numbers are the numbers that really matter in Portland. And also these things are not tracked very well today. Even though we have in Portland a rental registry, they don't actually track what rent is. All the data we get is reported primarily by the landlord lobby, because they're the ones that have the data. So 1% of apartments are under $1,000 a month. 1%. Just 1%. 52% of apartments are between $1,000 and $2,000 a month. 38% are between $2,000 and $3,000, and 9% are over $3,000 a month. So I think when there's 10 times as many apartments over $3,000 as there are under $1,000, and you think about the fact that I was just talking to Jamie Partridge about this, that 15 now, we're about to hit a $15 minimum wage in 2023. That minimum wage earner can't afford any apartment. So it doesn't really matter if their wage went up 10% because they couldn't afford housing to begin with.
Or someone on disability.
That doesn't even factor in people on fixed incomes who obviously aren't getting any kind of increase.
But your base number where 5% of pay went up 5% and average rents went up 8%. That's every year. That's a good year. That's a good year.
It is.
Right? We created rent control, last session, 2 sessions ago? 7% plus whatever the cost of living went up. Well, this year, what is that going to be? 15? So that's what they can raise the rent, and nobody's getting those kind of raises. So the trend that we started talking about just keeps going. Richard, is there any data on the numbers of people who became homeless due to medical costs?
Yes, medical costs are a huge driver. We know that about a quarter of Americans are currently paying medical bills right now. And 60% of all bankruptcies are from medical costs. About a quarter of low-income families report that they have trouble paying housing costs. We have studies in Philadelphia that show that about 9% of homeowners who are currently undergoing foreclosure is directly related to medical costs. There are surveys of people experiencing houselessness in Seattle that show about half of those people are having trouble paying medical bills, and about a third of them relate those medical bills directly to the cause of their houselessness. So yes, huge problem, huge driver. And of course, the cost of medical bills from an unplanned surgery, a medical condition you come down with that you didn't want or ask for, rising cost of prescription drugs, rising co-pays, premiums, deductibles, insurance costs rising, year after year are just huge drivers and really a huge detriment to our system. It's also very complex to navigate these medical labyrinths, that people find themselves in. So it makes a huge driver and a real big problem. Yes, please.
I just wanted to add on that note, in Oregon there's only 2 hospitals that are for-profit, and the rest are non-profit or public hospitals, and yet we had to pass a bill, the charity care bill, that to force these non-profit hospitals to actually provide free care that they're supposed to be providing as part of their status as tax-exempt organizations. And yet we've seen in Washington, the state is having to go after these hospitals because they're not doing it still. Washington has a similar law, and so I wouldn't be surprised to hear in Oregon that the same exact thing's happening, even though if you're up to 450% of the federal poverty level, you're supposed to be able to access, essentially free care. Is the hospital actually telling people this? Let's be real.
Yeah, and the Oregon Health Plan is a great health plan, right? The folks that qualify for that know about it, that are told about it, that are given the opportunity to apply for it, which is not easy. It's a great health plan for them. But then you have the folks that are probably paying 50% of their rent, 50% of their income for rent. And they just got a little bit of a raise and just puts them up over the top where they no longer qualify for the Oregon Health Plan. And they're a whole long ways away from being able to afford health insurance. So we've got that big group of people in the middle there that's part of the issue. They teeter on this edge of houselessness all the time. One minor medical emergency can put them out of the house. Kevin, does Oregon currently have the capacity to house the population of people who need ongoing mental health care? And is there any more in the offing?
Yeah, good question. I was looking at this and I was thinking, are you talking about long-term permanent housing, or are you talking about treatment housing?
Well, treatment, long-term, in many cases, long-term treatment housing. Because they, for some folks, that's what it's going to be.
Yeah. So let me just break this down for you. When we think about people in Oregon who are needing mental health care, directed by the judge or the psychiatrist or the probation officer, there's three particular classes of folks that are filling up our institution. One is aid and assist. So I commit a crime, but apparently I'm having some mental health symptoms, and the judge says, until you get treatment for that, you're not going to stand trial for that. So that's the aid and assist population. The other population is called the guilty except for insanity. So I committed a crime, but I was in a significant psychosis, and so therefore the judge says, due to your serious mental health challenges, we will not try you in a criminal court. We will take you under what's called the psychiatric security review court. In old days we used to say the criminally insane. And then the third group is what we call those folks who are civilly committed. So you go to the hospital, or two doctors like Dr. Bruno and a friend could say, we believe so-and-so meets the criteria for civil commitment, and that criteria is basically current and present danger to self or to someone else, or inability to feed and care for oneself. So currently our state institution, our state psychiatric hospital, is overwhelmed with the aid and assist population. There are so many individuals in Oregon getting in front of regular judges, circuit court judges, saying, we're going to hold on because we think that you need some significant mental health intervention before we try this case. Those folks at the state hospital are crushing out the civil commitment folks, and the civil commitment folks now are staying in St. Charles and Providence and Unity under commitment, sometimes for 30, 60, 90 days, because there's no room at the state hospital. One of the highest growth things that the state is actually working on is what's called an SRTF. So that's a secure residential treatment facility. And so those, in order to be able to bill Medicaid without a waiver, those are usually 14 to 15 person places. They're secure. I mean, it's a locked compound. There's one on 133rd and Powell Place. And those are the state likes those because you can commit somebody there. You don't have to put them in the state hospital, and you can use Medicaid to pay for them. There's a significant move at the state to grow more of those, which is good in some sense, but it also bodes not very well that they're secure in their locked places, that people aren't going to there voluntarily. And one of the challenges is what it suggests is we have a whole lot more people, and if we just use the scale, I've been psychotic half my whole life, so if we just use the scale of psychosis or acuity 6 to 10, there's more people at 11 than ever have been in Oregon. Even with the population change, there's more people knocking on Providence, on St. Charles, on Unity saying, I need to get in, you can't go there voluntarily. The challenge that we have is those people who come out of the state hospital, that you can go to a secure residential treatment facility, you can go to a residential treatment facility if you can find a bed. And some of those are only mandated, you can only stay 36 to 72 months. The particular challenge is that in what we have done to our short-term care providers, for, like, say, I'm having a challenge and I need someplace to be, a respite bed. We have cannibalized our respite beds and some of our residential treatment beds as step-down facilities for people coming out of the state hospital. And no, we don't have enough, and no, we aren't bringing enough online. Particularly just residential treatment beds in residential group homes, we've seen a collapse of that, and children and adults, 20 to 30% under COVID. And there certainly is plans, and there's been a lot of new money through ARPA, through the Biden COVID Act, and through the Trump CARES Act, but it's going to take a while, and we are way, way behind the eight ball. I don't think I'm going to paint a very rosy picture of some of this.
So those would be, other than the three that you outlined here, where they would be voluntary.
Well, so they're all right, and there are people in the community that are voluntary that never end up in the clutches of involuntary treatment, but also would like some residential or some respite supports. And I can talk later about what we did in session 2021 to help bridge that gap.
Thank you. That was so clear. I learned a ton.
As a person all my life who's on my medical file to prepare my schizophrenic recovering alcoholic, and I meet with people who say, how can you suffer with schizophrenia and still testify and run a nonprofit and get legislation passed? I do think that people in the community that I come from, the awful label called STMI, serious and persistent mental illness almost identifies you before your personal identity at times. So almost, and the doctor could probably also speak to that. Those people who are often given that label are some of the most challenged with their mental health challenges, with social acceptance, with sociability, with finding meaningful community. And it is this, I've been doing this for 35 years when I haven't been on the other side of it, and we have a crisis of community and support of community for these people.
Yeah.
And it's heartbreaking.
Yeah.
It's really
And a
heartbreaking.
lot of those folks end up on the street.
Yeah.
Right?
Yep.
Yeah, I mean, it's been really helpful, so we have brought onto our staff folks who were on the streets and suffer schizophrenia, and it's been so helpful because to be able to almost be a translator in terms of the voices that people are hearing all around us as we're working with them, I just felt like in some ways that we've been able to make great strides by opening up our space and our capacity. Here's the floor.
All right, so that's, Kevin did an amazing job of creating clarity. I mean, the fact that he didn't mention, which to me is the most horrific, is that Oregon ranks last in behavioral health care in the country. In the country. When you rank below Mississippi, you are really screwing up.
Yeah.
So there is a lot of work to be done in that realm alone. Just that piece. And it intersects the houseless community deeply, but it's affecting all of our society. Just think about the last 2 years that we just went through, how the last 5 years that we just went through. And the number of people that need some level of mental health care and can't access it. And maybe later we'll get into some of the reasons, some of the why for that. All right, and this is for all of you, and this is one of those that we can start to have a conversation. So, what are some of the issues facing the chronically homeless population that will need to be overcome in order to successfully house them? And maybe, Kaia, you wouldn't mind defining chronically homeless, because I don't think that's a sort of a well-understood term.
Yeah, I actually don't know. Do you know the numbers in terms of how many years?
I don't either.
Yeah, I'd have to look and figure the number, but people who are persistently on the streets and return to the streets versus the short-term, experiences of homelessness. Yeah, that's a really interesting question. I mean, I think in some ways, I think that the barriers that we put up as a society are some of the big. And what I mean by that is, I just was speaking to a street roots vendor yesterday, and she asked me to sit down and interview her about her experiences of being swept right now. She's been homeless on and off since 2016. She's in a wheelchair, and her boyfriend is her caregiver, so whenever he's not able to stay in the shelter with her, everything falls apart. And she's diabetic. She's a number of health problems. And she was just talking to me about, she was just in the shelter again. And some people might have read about her because the week before she was in the Willamette Week about how she had been housed and then put back out on the streets. But she just said to me, I really want to be in housing. Like, people often think that we don't, like that there's all these things that have to be done in order for us to be housed. It's just not true. It's just that she's basically in survival mode all the time. So she was just in shelter, and she just wasn't making the 9 p.m. curfew. And I'm not begrudging this shelter for having its rules, but I'm saying that adults that are trying to jump over all these different hurdles, and then that falls through. And you know what she was doing on Friday when I saw her? A woman in a wheelchair. She had a cart and another wheelchair, and her boyfriend had jerry-rigged basically a cart with all of their tools because they've been swept 3 times. And so they now can't even keep their tent down. but they just keep packing up and moving. She's in this wheelchair, and she's like exhausted. And I sit there and I listen to her, and I'm just like, oh God, if we just she just needs to be in housing. It just needs to be housing first. So, probably permanent supportive housing for her. But that's it, right? But she's jumping through so many different barriers all the time. This piece falls apart, this piece falls apart, and then she's back on the streets, and and she's just trying to piece it together and sort of duct tape it together again and again. So I guess I'm saying, in a way, I feel like sometimes it just becomes too complicated when it's just a goddamn house that she needs, right? Mm-hmm. Yeah.
Any other responses to that, Kevin?
Well, what I wonder about is who's the paternalistic sort of watcher who frames what needs to take place in order for you to get housing. People know who Homer Williams is, the guy, the multimillionaire who developed the South waterfront and the part of the Pearl District. I mean, one of the things he was arguing when he was trying to put together with the navigation center under the west side of the Broadway Bridge is some people are not ready for housing yet. Some people need to be, they need to be getting more distance. I don't even know exactly, but it smacks of a paternalism, and it smacks of a system that not only is racist, but not just as well as classist and sanist. Some of our ideas of what incapacity a person has, and also the ability to, how much different is your life if you have a safe place? I mean, the number 3 need for a human being beyond food and sleep is safety. And so how many people who are presenting and may have some issues that make the button-down class nervous or uncomfortable with their emotionality, because there's an awful lot of that that goes around. How long does it take to sort of get back your natural circadian rhythms and to feel like you have some dignity and stuff, not like you're a charity case where people look at you either fearful or like they have to caretake you back into some solution that doesn't fit for you? I think it smacks more of the people who say, what needs to take place before you can get a house, and I just think it's bullshit.
That's
One thing, there's a place called Portland Hotel Society, and it's now not called that, it's called PHS, but it's in Vancouver. And one of the things when I was running a state housing committee for people with severe mental illness is they talked about, we believe everybody should have a right to housing, and to the degree that we can afford it, anybody and everybody who comes in our door, we will provide housing for with you don't have to sign on to any therapeutic agreement. These aren't wonderful places, these are concrete floors with a drain, but we believe that everybody, even if you're hard on housing or hard to house, has a right to an individual safe place to go to. And we have heard that's something that we should move to, but we haven't seen it here in Portland.
Yeah. So such important points, Kevin. And I'm reminded of some of the work that's been done in Houston. And there was a New York Times article that explained some of the work Houston has done recently. Over the past 10 years, they've really been able to sort of get a lot of the groups that are working on houselessness together and really break down some of those barriers to working with government agencies. And they've been able to house 25,000 Houstoners.
Oh, it doesn't want to stay out.
All right. Thank you. 25,000 Houstoners have been able to get housing in the last 10 years because they've been able to work together. And they don't have these requirements in place that you have to have, this or that, or be working a job, or have clean urines, or whatever it is. And I think that there's a great quote from that article where it says, we shouldn't have to require people to learn how to swim as we're pulling them out of the water to save their lives. We really shouldn't. And we'll keep that swim later. Let's get your life saved right now. And I think that's a really important point. Another thing that I was reminded of, just as you were talking about circadian rhythms and sleep, and I think this is a really sort of poetic example of that I'd like to get sort of the scientific background. When you go into dream sleep, every night you sleep in 90-minute cycles, and you go into deep sleep and then dream sleep, REM sleep, where your eyes are back and forth, and certain muscles that are active besides your lungs, the ones that control your lungs. And as you're sleeping, you're dreaming in that REM sleep. when you're in that REM sleep, you become hypothermic, so your body adjusts to the ambient temperature around you. If you're sleeping out on the streets, that's not very good to be to get cold with the ambient temperature. So you actually suppress REM. So you're actually decreasing the amount of time you are sleeping in REM and dreaming. So essentially what we're doing is robbing people of their dreams by forcing them to sleep outside. So I say let's give people their dreams back, their hopes back. Let's house them. Let's house them.
All right, well, kind of on it. So I guess I want to explain a little bit why I asked that question that way. And it does come down to a way a lot of the government agencies and housing providers think about the housing community. They say there's sort of two groups. There's the groups that if we just get them housing and a little bit of training and some opportunity, they're going to be okay. And then there's the groups that have been living on the streets so long that they're not even comfortable indoors. And I don't know for a fact if any of that's true. Clearly, at some point, there have been difficulties with some people for some reason. But I think it's what it says to me is that the houseless population is not a monolith. Right? It's not there's not a single problem that we solve this problem. All these people have this problem. We solve this problem, they're all good. Right? There's a lot of externalities. There's a lot of other issues. Mental health. Do they have a physical disability? Right? Are they going to be able to get employed? Right? So we build this housing. Right? 0 to 30% area median income. Well, what that means, when we say that, just to be clear, if we're building an apartment, we say you have to, you're in the 0 to 30% area median income, you will be paid as if you are 30% area median income. There are no apartments built for anybody who we're expecting them to pay 0. And that's across the board. To my knowledge, every government-built affordable housing unit that's as good as it gets. You've got to come up with 30%. Right? Now, maybe some government help from a different agency, from the feds, from Section 8, but somehow you are responsible for 30%. And this, I think, enters into it, Kevin, as much as anything, is that's the paradigm that we've created, and then we have a problem when somebody can't, right? They can't get a job for a variety of reasons, many of which are not their fault. So,
I was just thinking, there's that myth and the horrible term service resistant, because I think it's important always to interrogate that. I mean, using that with humans, but also maybe those services that aren't the right services, right? Like, you really need to be starting from the person and finding out what someone actually needs. And I also feel like there's a lot of mythology around if someone's not, if they're getting swept and they're offered a shelter and they don't take the shelter, then somehow they don't want housing. But I see again and again that people that often don't find the conditions of the shelter, perhaps it's the congregate setting that is incredibly stressful at mental health. They don't want that. That doesn't mean that they don't want housing. So I just think there's a lot of mythology around that.
yeah.
I went on some friends of mine, there's 3 different agencies, I think Central City Concerns, one of them Transition Projects, and a group called Mental Health Association, Mental Health and Addiction Association, working. They all have teams of peers that go out and go to the camps and the sites and say, does anybody want to sign up for the early health plan? Does anybody want to get on a shelter list if there is a bed? And the interesting thing I learned of my friend who runs one of these for NHAO, a guy named Jeff, he said, we have different tiers available when we say, anybody want a bed at the Clark Center? Well, no, thank you. Anybody want to stay in an open bay at the Greyhound in Old Town? Well, no, thank you. Well, out on 110th and Sandy, the roadway in the Quality Inn had just been bought by Multnomah County.
Yeah.
Does anybody want that? And he said, we initially have to offer them the lowest tier, and then the people who are in the shelter then are given the opportunity purportedly to get one of these, one of these Motel 8 or
With the locked door.
Yeah, with the locked door and your own sink and all that dignity. And he says, when we have those available, the people who snap up those who have dignity and a private home like we all do, versus wanting to live in an open an open bay, where there's a lot of people who are struggling with loneliness, with depression, with psychosis, with methamphetamine issues, with domestic violence issues. And it's not a very nice thing to say, and I've been a person who's been involved in the criminal justice system. There's a certain amount of folks out there that are, well, maybe not parasitic, but there's a certain amount of criminal element out there of people who prey on the vulnerable in our shelters at tent sites. We walked up on one, and there was a domestic violence thing happening once. And so I think we need to look at what, you don't want the shelter bed, does mean you don't want help. Well, maybe my nervous system can't handle that stimulation. And maybe the person who's beat the crap out of me last week in front of the health department is staying there as well. And some of these things are just frustrating. I was going to ask you, Mark, if your district represents somewhere to 40 to 45,000 people, is that right? So in Oregon currently, it's going to be peeled back because of COVID mandates or mandatories of disenrollment, et cetera. But currently, 1.4 million Oregonians are on the Oregon Health Plan. So that's about 33%. Yeah, I'm on the Oregon Health Plan. And one of the things that just from a sense of why don't we hear more, why isn't there politicians saying, I want to talk to a third of the Oregonians who are on the Oregon Health Plan about what's working for them, where they were stigmatized, where they were discriminated against, where they were told they could get a mental health provider, or they could see a psychiatrist or a primary care, and it didn't follow through. We have a significant problem in Oregon, particularly the state agency, is listening to the voice of the people who receive those services. It's a huge problem, and that's why they miss the mark so significantly with thinking about what community means, what friendship means, what meaning means, things beyond just giving somebody, it's like Prexapro, and I think that's a real problem.
So you guys have done such a brilliant job. I'm skipping the next question that I have. And I want to pivot to a concept that we're playing with and bounce it off and see, does this make sense? So how many of you are familiar with what they're doing in Eugene with their Conestogas? The Conestogas. So what they've done in Eugene is they've set up basically little villages. I think they have 2 or 3 at this point. And they've built these things that look like Conestoga wagons. But they're lockable. And their rules are you have to be sober. They do have restrictions, and they have curfews and all this stuff. But what they're finding is the folks that are able to utilize these units are accessible to the folks that want to be able to get them, whatever services they need. If it's meds they need, if it's a doctor's appointment they need, if it's a training or an opportunity at a job center or whatever it is, they know where to find them because they have an address, they have a place. Their stuff is safe, they're safe, they have toilet facilities, they have kitchen facilities. They basically functionally have a home for all intents and purposes. It's not elegant, it's not anything anybody would desire to do for a long period of time, but it is, I think, perhaps a solution because they can build those things for a whole hell of a lot less than $250,000 a door. Right? That's currently what we're talking about. We're talking about building affordable housing right now. Cost of construction, blah, blah, blah. $250,000 per door.
How is it different than the state grassroots here in Portland?
It's similar, and I'm frankly not as, I haven't gotten to
tour the Safe Rest Village, so I'm not as familiar with them. I was down at an LOC event, and we got to tour the Conestoga villages. But, Ilya, are you still in the room? So when he comes back, just ask him. He's on top of having a phenomenal little theater experience, which we're all getting to enjoy. He's a contractor, and he and his brother have come up with a concept where they can build tiny homes on wheels for about $20,000 a piece, $25,000 if you want to home it. And imagine how many more of those we can create, and create little villages all over. Make it mandatory. Every city has to take X number per capita. And that then gives folks an opportunity to be safe, to be sheltered, to have access to the caregivers that are trying to find them. And maybe that's a step out. So I want to hear from you guys. Does that make sense?
I really support villages. Street Roots helped start Dignity Village in 2001, and I think there's a lot of different kinds. I think Hazelnut Grove is particularly admirable in terms of what it's become in recent times. I worry about state-run or municipally run villages in terms of a couple things. One is, I think that we see the slow creep of the Martin v. Boise decision that is essentially, as long as there isn't adequate shelter, people are not supposed to be criminalized on the streets. And there are ways in which these villages can be set up. I mean, this sounds very cynical, right? But I think that there are some efforts to sort of provide the adequate housing in order to then restrict people from being out on the streets. The other thing I think I would just put out as a caution, and I like the idea of these being built, especially people, if there's a kind of self-governance piece and people are really involved in it. But, Urban League can put someone in an apartment for about $25,000 a year in rent assistance. They can put a couple in an apartment for $40,000 a year. So we actually have some pretty basic mechanisms. They can do a master lease and do those kinds of numbers. And it just, for some reason, it's just hard to get. It's not sexy in some ways, just to get that funding to support what actually, these, like a nonprofit like Urban League, like Join, is already set up to do wraparound, and that's wraparound services with people in apartments. The Project Turnkey that, is the statewide purchase of motels. Now those are probably more like $110,000 a unit now if you get them in Portland. I've been going and looking at some of the motels because I can't get regional government to fight and buy them. But you can get several people in a number of these rooms. So again, we have a number of vacant spaces that also could be used and actually, there's the laundry facility, the shower and everything. So I guess I sometimes worry that the villages, like the Safe Rest villages here locally, are the prices going up and up and up and up. And so they're becoming a really expensive model to just keep people outside and wraparound services, when I wonder why we could have quite a few rules, why we couldn't just have Urban League get the apartment or buy up the motel. So that's the only thing I get nervous about.
Can they bring that to scale? I mean, you have a sense of the
I think Urban League and Join and all these, they figured out how to do it. They just need more. It's working with the private market, so it's getting more landlords to lease their apartment as a whole. Yeah. But there's hotels. I've identified 4 in Portland that could be bought, and that would be about 160 rooms. Most of them could be couples. So I think it's interesting. I just think that,
there's red flags. You have red flags.
There's some red flags.
Anybody else any thoughts on that?
I'm just going to say, not too far from here, I toured it in late April. It's called the Clackamas Veterans Village. So have you been out there, Mark? So it's 15 to 20 little pods, and then they have 2 or 3 double wides with kitchens, showers, everything. And then they're very modest little units. But I was there, and some guy said, I was homeless. I was houseless for 30 years. This is the first place that anybody ever reached out and said, and I like it here. They asked me if I want to move on, but it's just simple and comfortable, and I feel safe here. I was interesting to look at that.
Yeah, I guess my only, I have a couple of issues with that particular village. One is out in an industrial area, pretty far from pretty much anything. Anybody. Transportation's tough for those folks to try and get somewhere else, anywhere else. And they spent more money setting that up than they would have if they had just bought hotels for the equal number of people. So, and those hotels would probably have been on bus lines, and in urban areas that have more access to food and all the things, right?
I think your model, like Portland State just did a really good study on villages, like to make sure that there's enough self-governance, to make sure that it's not a required, situation. I think that it can be a successful model.
I think my red flag, I guess, about the Safe Rest villages is, it seems like there's people that are, there's a lot of funding that's not being tapped into, and in their eagerness to say they're doing something, they're awarding contracts to, brand new nonprofits that, in that case, their workers tried to form a union. They fired the main organizer. They had humongous safety problems. They didn't make fire extinguishers. They didn't offer any training. And hearing that there's nonprofits that have all this stuff figured out. My question is, I think, when you're considering contracting these sorts of things, it seems like the tendency is for the governments to wipe their hands in the situation and say, well, we signed a check, whatever happens after this is not our problem anymore. And I think that's the risk. Yeah, exactly. And I think that's wrong. I don't support contracting unless they're ensuring that it's responsible, that the contractors are responsible, that they actually know what they're doing, and then also that obviously the workforce is being treated properly. He agrees with me emphatically. And because ultimately, these workers are really underpaid because of this idea that folks have that just because this population is going to need money, that means we shouldn't be willing to spend any money. And so therefore, we have mental health workers who have master's degrees and doctorates who are making less than $20 an hour.
Right.
Which is just absolutely mind-blowing. When, other healthcare workers with similar credentials are making $50+ an hour. It's time that we actually recognize that this workforce's work matters, and it shouldn't matter how much money the population makes or how much it brings in. That we're going to have a much more sustainable, when I think about that previous question too, part of the ability of these programs to be successful is actually having a sustainable workforce. These relationships with patients, speaking as a former healthcare worker, it takes time to develop a trusting relationship. And if these people are seeing different people every single day because turnover is so high because they're getting paid $15 an hour, that's a huge barrier to success.
Yeah. And that's the conversations I'm having with a lot of the folks that do mental health care at the social service level is exactly that. We're purging staff so fast that we can't replace them because they're so underpaid, they're so undersupported, they have huge caseloads, vast caseloads that are ridiculous.
I mean, how do people feel about their public money being spent on union busting? I'm just wondering. Ergo is a contractor for Multnomah County union busting, Central City Concern, I'm sorry, Economic Management. Public contractor union busters join as well. Not join, sorry, there's a lot of different contractors, I'm sorry. Yeah, you're not joining, sorry. And, you know, that's another huge thing is with this lack of follow through when we are giving this money out. You know, not only are they not treating their workforce well, but then they're spending money on, you know, making it harder for their workers to have a voice.
Right, and that just says it out. You know, if the very people that are providing the care are living so far on the edge because they're so poorly paid that they are teetering on the edge of being their own client.
Right. Exactly right.
So, yeah,
And if we want to save money, supporting people who are working hard to build these shelters and build these homes and maintain them and support residents, or do we want to spend money on criminalization and hospitalization and constraining people's rights?
Well put.
so another piece that you might be able to speak to on the whole village concept. Do you believe that people who are listing that as an address when they're applying for jobs, that would be counterproductive? That would be just as bad as them saying, I don't have an address?
You know, I think it really depends on what job you're applying for. You know, a lot of companies use automated HR that I can't imagine they would screen their address other than maybe seeing do you actually live in the area. You know, as a former UMS worker, address is like 111 West Burnside, like etched in my brain forever, but I don't think employers typically know this address off the top of their head, so I can't see that as, and there are also a lot of, and Kaia can probably speak to this better than me, a lot of different groups that offer addresses.
We have hundreds of people that get mail, and I think Rose Haven, TPI, Commons.
So, I mean, I'm not going to say it's never happened, but I have not personally heard of that as being a barrier. Not having an address is a huge barrier for sure.
Right. All right, let's pivot a little bit and let's talk about Measure 110. So, great concept. The idea of decriminalizing possession of drugs so that we stop the whatever the jail pipeline, school to jail pipeline that we've created in the United States. The concept, also a good concept, that the funding would, instead of being in law enforcement, the funding was going to go to treatment. It's worked well in Portugal, something similar to that. And one of the differences, Portugal has universal health care. We don't. How is it rolling out? How do you feel? I don't want to preface the question with what I think is happening, but how is it rolling out?
Can I just see a show of hands? Who thinks that we should send people who are addicted to drugs to the state penitentiary? Who's in favor of that? I don't think anybody disagrees with the issue that I should not become a felon because I'm addicted to heroin or fentanyl. One of the challenges, and so I've been watching a lot, and I just talked to the county association last week about it. One of the challenges is that the front end is decriminalized drugs. We shouldn't be sending people who are addicted to heroin or methamphetamine or even alcohol or whatever. We should not alcohol, but we should be sending those people. We shouldn't be getting those people involved in criminal justice. It's not a crime. It's addiction. It's a disease. But the challenge is that the way that the back end, the way this was put together, and I just want to push back a little bit. It redirected a cap. Everybody else was getting cannabis revenue, and it redirected everything above that to go into Measure 110. The challenge is, and some people are getting alarmed that we're even asking such questions. And it's just what we do. What we wanted to know is, and we asked this from the counties to ask folks at the state, out of that 270, 300 million they're just giving out, how much of that is actually going? We've lost 20% of residential treatment beds. If you wanted to go and you were on Oregon Health Plan, you say, I want to go to treatment today, most likely you'd be on a waiting list because there is no open beds, and we've lost 20% of those in the last 3 years. So the question that some of us are asking, and not just independent advocates, but large groups like Central City Concern, LifeWorks, which is another huge provider, said, how much of this money is going to supportive services, some important services, all important services, of course. But the question is that we're trying to dig into a little bit deeper. Is this 300 million putting on the plate now and there's going to be more money coming later? How much of that is actually restoring treatment beds for people who want to go to treatment today? How much of that is going for that? And how much of it has been payola to new contractors so they can cheer for their state bureaucrats and how great they care about this special interest group or that interest group? It's been a challenge. And I also think the voters, you talked about Portugal, I think the voters were misled. We don't have the robust community mental health system that they have in Portugal. And then secondly, there are things in Portugal. If I get caught shooting up heroin in public in Portugal, there are things that they can do. They can restrict my travel. They can cancel my health insurance. So there's some things that what they do civilly to encourage and compel you to look at the issue of addiction that we don't have here, and we don't have a community mental health system that it's in shambles because we're using all our money for crisis. I think that the voter did not understand the back part of this significantly enough. 2 out of 3 governor's candidates said they're going to repeal and reform this. And I don't know whether they want to take back the decriminalization of drugs, but I think there's a definitive interest is why aren't we triaging with that 300 million? Not the frat boy at U of O's got a drinking problem. Those are important issues, and not to say that they're not. But there are people on the corner of 39th and Hawthorne and Chavez who are struggling with psychosis, methamphetamine, fentanyl, body sores, houselessness. Why aren't we triaging and putting that money up front to address the people in the most severe issues? And that's not happening. And the folks the Drug Policy Alliance, a great group, national group, but they are very, very defensive of us talking about some positive things here, but some other things may need to be tweaked, or maybe we may need to redirect some of that more money to buy more treatment beds. And it becomes radioactive when you're up against an organization that has the communication arms that they do to try to have such a discussion on public government.
Thoughts on this?
Yeah, it's really tough, and I've been kind of trying to learn more about this distribution. You know, we received some of the Measure 110 funding at Central City Concern, and we are actively trying to utilize that money to create new avenues and new rooms for people. So we have about 2,500 units in the Portland metro area. We have bought some of the hotels that went out of business during COVID. We're building new buildings all the time with that money. But I think there are some holdups and there's some bottlenecks there that really need to be thought through. And I think there's a lot of organizations working to make sure this is done in an expedient way. So more to come, and we're actively looking at it. But I think it's really important to get this right.
I mean, do you think, just thinking about, some of the folks that you're talking about, I'm thinking about outside the building where I work on the Riverside.
Yeah.
Do you think if somebody with the same consumption sites started moving into an area where we had healthcare providers so that we didn't have to worry so much about people dying?
Oh, I'm a huge fan of the concept, and we can probably spend another half an hour talking about safe consumption sites or safe injection facilities or overdose prevention sites, as they're called. You mentioned the Portland Hotel Society earlier, Kevin. That's one of the sort of the preeminent overdose prevention sites in the continent. And what they do, and I've been downtown to Insight there and seen how they have people coming in, get cleaning materials and paraphernalia. You do what they're going to do, and on the way out, they with the social services. They come back tomorrow, get you to detox, whatever you need. We're here for you, and support that. And they've been able to cut down the HIV and hepatitis C incidents dramatically, over half in the first few years they were open. It's really an amazing concept, and I think it would work really well if we were able to do something like that in Oregon. I would be a huge proponent. I've given testimony in Maryland for the past few years, and I was there in support of this concept of opening one of those types of facilities or multiple facilities where you could have people legally do it. We were running into some of the federal level pushback around sort of the crack house clause and not sanctioning drug use within a government-supported facility. But I think there's ways around this, and I'd be really interested in working creatively with folks to get something like that passed here in Oregon.
Yeah, I would love to see that. I think about the people that are having contaminated substances and they're just in such health crisis. And I always just look out and think, oh, we just have a nurse nearby. And,
Yes.
supply is safe.
Can I ask the doctor a question about the relates to measurement? So one of the issues is if 3 years ago, if I got caught by Portland police and I had heroin on me and there was enough, they could say, this is a felon, go in front of a judge, here's the charges against you, Mr. Fitz, do you want to think about treatment? You may or may not, this may present that you have a serious addiction issue. So Senator Pazanski, who oversees the Senate Judiciary and Measure 110, he said this 6 months ago. He said, I fear that we have lost the ability to compel the addict to seek treatment. 15 states have on the books involuntary commitment and treatment. Different, some are a week, some can be up to 30 days, some up to 360 days with administrative law review. Where are you as a physician in seeing that just if you get caught with possession, a judge won't see you, you'll get a citation, and you won't have a felony? What about the issue? Are there some folks that are beyond, from a medical point of view, struggling without the lack capacity to say, my cerebral cortex is cooked. I can't make a decision to stop using that. And what should we do?
Yeah, it's a really tough issue. Yes, there's the capacity issue. There's the element of autonomy, right? We have to allow people to make their own decisions. It's hard to compel somebody to do something they're not ready to do. You think about the stages of change, Prochaska and Di Clemente, cycles of change. It's like, if people are pre-contemplative or contemplative, they're not quite ready to do it. It's going to be pretty fruitless to try to force somebody into sort of drug shooting. It's not for you, Siri.
Siri would do it.
But yeah, but I hear you loud and clear, Heather, and I think this is really important to get right, is that we have to have those treatment options available to people when they're ready to do it, because otherwise, it's just kind of fruitless. I found, and let's just keep trying. Let's just have those available when people are there.
I think another piece that a lot of folks aren't aware of is that the funding for 110 has been slow to roll out, particularly to the Portland Metro region. It rolled out in the rest of the state substantially faster than it has in Portland Metro. Yeah, so it's there's a lot going on there, and I'm still in a wait and see mode. I want to see, can we do this, because I've always been very impressed by Portugal and the success that they've had there. So we got to get universal health care.
Yes.
To make that work, we got to get mental health care.
Yes.
And be robust.
And thinking housing too. I think about Matthew says because of homelessness, people saying, be physically safe. Or I know one guy who is deathly afraid of rats, so he actually stays awake all night so he can sleep during the day when the rats aren't out. But all these things, but also housing itself is part of one more solution to this.
Yeah.
It is 6:30.
Let's take 5 minutes. Use the facilities. There's one upstairs. There's a whole bunch of them downstairs. Grab another beer or whatever if you want. Grab a plate of food.
Lots of food.
Lots of food. And we'll come back here in 5 minutes.
Maybe kind of a lot of questions, like you just have a place in Hollywood, and you can drop off a handful of that asphalt, and they will analyze it for you.
Yes, it's meaningful. Yeah, so our problem is my fault. There's a lot of One of the things I hope our students understand is why you're know what your needs are and be able to say, I need more than just the diagnosis.
it's really interesting, a lot of that mental health workers, like having,
Well, I guess when I was the friend of the agency that got the contract to run the so that's mental health and it's changed going and so they got the contract to run that. The first two floors are going to be the second and the third. Yeah, good job.
and just like go
And then the third and fourth report one is typically three blocks behind the Benson and two for the brand new Ritz.
It is, what I know, oh yeah, somehow he not only not putting it in, but not paying it. Just do whatever they want, you do whatever they don't. Excited about the hotel. The county's thing with the grass, is that part of that, or they're saying that, of course, our hypothesis we use that landlords aren't going to do it because they want control. I think our hypothesis is not and that they actually care way more about that than they care to
I might have one more question, and then we're going to open it up to all you all and folks that are online. So that's kind of what the second half is about. Check my notes.
Can I make one more point about medical intent? So one of the, I run a single nonprofit, and I'm always looking for novelty, for looking for innovation, and all those things. One of the exciting things about medical intent is it brought some new contractors, nonprofit players to the table. But the challenge that we have with this current administration is there are folks that have never ran a nonprofit, that never have contracted with the state, that never understood, that have not been taught and don't understand reporting requirements and all the things that they agreed upon getting this money. And to add, and which it's phenomenal the amount of new contractors, particularly in areas of diversity, that have come to the table. Unfortunately, with folks that have not been to the rodeo before and have not been a contractor and are just starting to put up a nonprofit, that they have not been, that there's been some challenges with some of those small organizations not understanding what was required of them. And the biggest issue, and I just heard this last week, is that these contractors, that every single one of them, you're getting 40% of your money up front, and the rest, they will start paying out on a monthly basis. But until the monthly basis payments start, you need to exist on your capital reserves. There are a lot of really small nonprofit groups that don't have hardly anything in capital reserves to make more than 1 or 2 or 3 months of payroll. And also, like I said, there are organizations that just stood up a nonprofit just so they could move forward and be an applicant. The lack of awareness and consciousness from the people who run our health authority and our behavioral health authority, it's unconscionable because people are going to fail and there's going to be friction and it's going to interrupt getting those behavioral health resource network dollars out there to help people who are suffering. And why I'm looking for people like Mark and so excited about him getting into the House of Representatives, having a voice and a conscience to poke the machine to say, you need to understand you're setting these people up for failure, you're setting these people up for unnecessary work. It doesn't have to be that way.
Good, great point, thank you. All right, so I'm going to sort of ask you the big, overriding, elephant in the room kind of question, and then we'll open it up to the audience. So, from each of your perspectives, what are the major changes that we need to make in order to get to the point where all people are living dignified and relatively safe lives? Just a little trivia, easy, 1 or 2.
Wait for the hard Well, I mean, I think it just kind of goes back to some of the what we've been talking about before, Mark, is that we need to give people keys to housing, and we need to do that without restrictions and stipulations. And then we need to have programs available for people to be able to get their lives in order, get back on their feet, get foundational support for what they need to do. And we know how to do that. It's just sort of like herding the cats, making sure that agencies and organizations are working together. And I think it just takes a lot of really important leadership. And I think it's really just getting the right leaders with the right vision, getting the right people together to make it happen. We've seen elements of this happening around the country. Houston was an example we talked about earlier. LA is making more strides there. We can do it in Oregon too. We really just got to get creative and stick to it. I'm hopeful. I really am.
Great answer. I think the main thing that comes to mind for me is we need to stop doing half measures. There's this idea that I think anyone who's spent any kind of time doing government relations can tell you that there's a lot of people in Salem who want to make everyone happy. When it comes to tenants' rights issues, they want landlords to be happy with the reforms that we made to the organized statutes to protect tenants, and so ultimately what we get is these bills that are half-baked and have so many concessions made that they don't actually accomplish what we set out to accomplish in the first place. When I think about, there's a question about SB 608 in here, when I think about SB 608, which we call the anti-price gouging bill, because it's actually not rent control, or it's not, it doesn't cap rent increases in a meaningful way, because there's a lot of loopholes. You know, that there was so many loopholes made, so many exceptions made, that it ultimately only benefits a small portion of tenants. You know, the same thing when we think about on the labor piece, when we think about the minimum wage increase, in order to, you know, I remember sitting in that hearing in, like, what was it, 2015, right? And hearing all these business owners talk about, oh, if we have to pay $13 an hour or $15 an hour, it's just being so horrible. And then look what happened during the pandemic. Suddenly they, you know, found all this money to make these, you know, humongous increases in their base pay when they couldn't find anyone who was willing to work for minimum wage anymore. But we compromised with them, and so now instead of 15, now in 2013, we in the Portland area only will get to the $15 minimum wage next July. So 10 years later, you know, that's you know, these things are all huge barriers. We need our legislators. You know, we always talk about we need a supermajority. Now we need a quorum-proof supermajority. You know, it's always, you know, just go out and vote. We just need one more Democrat, and then finally we'll be able to pass all these great bills. But then they just get amended to the point of where they're a shell of what they once were. And until we actually have, I think a big part of it is real reform on campaign contributions. You know, we're not going to get these bills passed that actually, you know, get to this point. And, you know, that applies to a broad range of issues. But I think any reforms to the law we're looking to make, we're not going to be able to get there until we actually have courageous legislators who are willing to piss some people off, some powerful people.
Yeah, I appreciate how Alli was talking about, you know, that fear of committing and just sticking our toes in or too many leaders sticking toes in certain solutions, or I would even say destructive tendencies that are superficial, that can look like solutions. It boggles my mind that in this country, people have a right to earn infinite profit, but not a right to housing. Right? Like, and you know, if we could simply decide that people have a right to housing and health care and start from there and make that happen, it would be possible to make that happen. Housing could be, you know, like public education, right? That there could be that people have a right to a safe, secure place to live. I spent a couple weeks in Sweden in June, and I was just kind of grappling with some of these questions, going around with some folks, some organizations that work with folks with houselessness and fellow street people. And I know there's a question about Amsterdam, someone was asking, and I think all these comparative models are really helpful. And I had some cognitive dissonance, I think, because I've been so entrenched in Portland in particular, but Oregon, in this whole pandemic, and it's been, you know, an extreme time. But to be in a society where there are some things that are really not working, but the right to housing isn't one of them. There is a housing first, as long as we force leader citizens, right? And that's when things fall apart, as well as the kind of encroachments of U.S.-style capitalism that is weakening a lot of the social safety net. But the fact that actually starting with the right to health care, starting with the right to housing, and then taxing appropriately to make that happen, versus the other way around in this country.
I don't know if this is so much about just housing, it's just
And maybe it's pessimistic.
I don't know if you inadvertently establish a caste system and then you want to go backwards, or you want to remove the caste system, what do you do? And my sister-in-law is here from New Jersey, and we were canoeing on the Willamette, and we were like, oh, okay, this is Southwest Portland, this is the West Hills, this is Northwest Portland, we could see, and I said,
Particularly this quadrant of the city has a lot less of some of these issues than the other 3 or 4 quadrants of the city. And she said, well, why is that? I said, well, the transportation of the buses is not as good. It's what was initially sort of more of a bedroom community for people who work downtown, but it's a whole different world.
one of my fears is, how many people ever went to a community meeting where you got to grieve what was lost under 3 years of COVID struggle and pain?
We don't. One of my biggest issues is we don't have meaningful community. Is that significant amount of people are atomized. I'm fortunate and been fortunate that I'm a partner in a bunch of good friends in my life. But I also know people who struggle with similar challenges that I have, who have no community, who have no family, and are atomized. What is their life, their sense of meaning? And I'm not, and even just not talking about people who struggle with mental and emotional disabilities. There's a significant amount of people that are atomized and extremely lonely. And the digital migration of all our consciousness, I think, has removed our opportunity for greater analog community and what that means. And I fear that that is on the run, that is disappearing significantly. And what I also fear too is with this atomization or this collective withdrawal to your tribe, and I'm not talking about political tribes, I'm just talking I'm middle class, I live in Charbonneau, or I'm poor, I live under the Burnside Bridge. It's a sense of cauterization of empathy to the other. And if Dr. Bruno can't throw a butterfly net under me and tell everybody else in the community that I'm safe, maybe I won't fit into that community because of previous diagnosis or tics or whatever my challenges are. The consideration of abnormal and unusual behavior, I get called on for being too emotional in governors' meetings, in testimony, all the time. This is not how you do it. You're sound too pained, you're too emotional, or having a manic attack or something like that. The challenge is talking to people who are human beings but represent an economic entity that purports with its advertising, its PR, to care about you is a bunch of hollow bullshit. Why it's so important for people, and I care about it deeply, to have leadership to talk about these issues. Like I said, your working class statement was the first thing I've seen anybody in this campaign season, at least locally, lead with that. And I think that that's particularly crucial since they have been demonized and left out of such discussion. But I fear that as a society and as a culture in our community, that our empathetic cords of umbilical connection have been cauterized or atrophied from lack of use. And I don't know how we solve that problem, but I think it's a grave problem for our state, for our community, and our nation, and our world.
Well, I think part of the solution, frankly, is that they need to continue to see leaders like you who are bucking that normality, right? And saying and being emotional. I mean, half the people in here can attest that I cry and drop that out. And I will continue to do that in the legislature. Because you're absolutely right. We have been trained as a society, particularly as men, that to emote in anything but anger is somehow weak, is somehow less than. And now, women, it's put on women, if they want to compete, if they want to be equal to men, they have to do the same. So we are creating a society where the lowest common denominator of emotional resonance with our fellow beings is bad. It's insane. It's absolutely insane. And it is truly the core of a lot of our problems. We have the lack of empathy for fellow humans, the lack of empathy for all the other creatures we share this planet with, the lack of empathy for the people who are going to come in 100 years. We have no empathy for that. And therefore we do nothing as a society, not this room, not these people. I get it. You wouldn't be here if you were that. But that is what our society holds as an ideal. And it truly is one of the biggest problems that we're facing, without question. All right, so there's already a hand raised. I have a handful of questions that people wrote when they signed up to come or to view it online. We will try and work some of these in. We'll try and work in some online questions. But let's start with a couple from the audience. All right, so please stand up and tell us your name.
My name is Jean, and I am with the homeless population in Lower Woods Park for an hour and a half every day at lunchtime through the Work of Peace House. And so I've been talking on these issues for the better part of a year now. So my question is this: what percentage of the non-poor population, maybe I could say what percentage of the housed population, looks at houseless people and say, they deserve it. They deserve it.
That's an awesome question. I don't know that any of us has the expertise to go there or that has seen a study. But I can tell you, I've knocked a lot of doors in Eastmoreland, in Selwood, and there's an awful lot of people that do believe that somehow those people are on the street because they failed. They're weak. They're stupid, they're lazy. Whatever moral failing they want to assign to that. But
Yeah, I mean, I was just thinking there's a study that was the Princeton neurobiology study that was looking at people's brains when they looked at different photographs, and they were seeing the registers of disgust when it was photographs of people experiencing homelessness or people who had the trappings of that. I mean, I'll say maybe this comes a little bit from a background in the arts, but boy, I sure am grateful to spend my days with people experiencing homelessness. I laugh more, I'm amazed more. People are under survival skills and the creativity, that's all around me, and the surprise and the unexpectedness and the humanity, the ways in which people are always taking care of each other. And I'm not saying this to romanticize. Of course, it's hard and brutal, and people act terribly too. But it's an extreme privilege. And I think probably you doing what you're doing probably would agree. It's an extreme privilege to know that.
What did people harden their heart? I mean, I think part of it is, due to fear, and also I don't know anybody in my social circle that has struggled like that, so it's hard to relate to it in that sort of sense. And if you read, if you belong to Nextdoor, you get people who are, people who are actively playing psychiatrist and doctor and, diagnosing people with characterological disorders when they have no idea about it. I think particularly part of it is fear. And I also think, I say it a lot, but I also think we're moving towards an idea of society and community that's a digital image that wants to be sanitized and wants to have behaved people who are comfortable and don't get under our skin and don't make us feel bad and don't make us feel guilty about our lifestyle. And so that's one of my biggest fears, is the otherizing of that person. It's not me. I'm going to go out, I'm going to come together with my family and my community, but those people are not involved. It breaks my heart. I was going to someday, hopefully Mark will join me. Every morning I walk from 47th and Clinton out to 82nd and Holgate. The
this morning I saw one dead person and I saw two folks crumpled over in horrible states of contortion. And I just don't know what to do with my sense of, God, I wish I had some ability to help you, and see the people who drive by and flip off the people at the homeless camp. That's maybe the leading edge of a lack of empathy, but I also think it's a sense of otherizing, that this is not from a world that I'm part of. Maybe I can have some sympathy for them, but oftentimes it comes across as paternalism, judgment, and forcing people down a direction that they may or may not want to go.
Probably twice in the last 3 weeks, I have been in a small group of people in which one person was clearly disgusted with the homeless people in their area. That's twice in the last 3 weeks. And I have decided that every time that happens, I'm going to speak up and going to say, I know Steve, and I know Ron, and I know Marshall, and I know Pat, who runs things at Peace House, and these people have dignity, and maybe you should think about that.
And I'm a retired teacher, and I have no problem projecting my voice as far as I don't need a mic. But I think actually, after these last couple comments, I'm thinking maybe I have the answer to my question. This is pretty much directed towards Kevin. I was a teacher for 30 years, and I had kindergarten in Portland schools, and I was born with scrambled genes and genes for profound mental illness and addiction. In the 80s, I was in profound, almost died a bunch of times, and I was in every condition and every illness that I had were all about isolation. And when I healed, my entire recovery was about connection. And the one reason I'm here and got to have these last 30 years is because there were 2 or 3 people, particularly one, who made a little island of trust with me when I was out there. And I think because I'm here and I've come back and I was there, I feel this, and because of the situation, there's everybody on the streets, when I see people struggling, for one thing, I lean in, and I tend to say, I have been there, keep hope alive. And my question, though, is about etiquette with the really profound mentally ill, because I have to notice, I talk to everybody I meet, and I make eye contact, and I smile. They say that the smile is the shortest distance between 2 humans, and it's love, there's no words. But I also talk to people, but I'm wondering, when I see people who are exhibiting definitely really severe mental illness, other people just walk away and turn the other way. And I want to connect with them, but my question is, what's the etiquette around that? Am I harming or helping? Am I actually making them feel like I'm singling them out? Because I talk to everybody. Is it threatening to make eye contact or speak sometimes?
I mean, just like I would never say the profoundly mentally ill group, I think every individual, I mean, we're all mammals, so we all have the radar of sort of, does this make sense to me? Is this person a safe figure? Is this somebody I can trust? I think that's very important. And I've been texting a friend of mine, in and out going using the Walmart restroom. I said, there's 3 or 4 young guys I've seen in here for the last week, and I talked to them in the restroom, and I see their sores on their arms, and I said, I would love to be able to maybe run a pilot project to see how we could help this group of guys and bring them together. I don't know, but if you fear for your physical safety, then that's an issue. But otherwise, attempting to connect and to show some genuine authenticity is what has held my life together, particularly.
Thank you. And after hearing that comment about people who are,
not accepting of everyone. I want people to know, you know, at least a smile and an acknowledgement of being seen. So that, I tend to try to make tiny shifts with everyone I do meet. But then sometimes I wonder, so that's why.
We spend $3 billion a year on public mental health services, about a third of that for a state institution. But none of that prescribes love or community or meaning. None of that.
When we were talking about how important like the street roots part of what has been really important for our folks is the community, coffee, people knowing each other's names. Someone gets up better to the point that they haven't been able to get. There's someone they can call, like I might call my brother, right? Just that, and I find relationship, the fact that I know someone's name, so maybe they're in the street making noise and kicking things, but I might say their name and say hello, and then they're just, hey Kaia, and then they kick it again, you know, but it's still like, it's like relationship, connection.
All right, we have one online question. Are evictions actually a primary source of homelessness? If yes, why are so many people being evicted? Is it getting worse?
I don't know if evictions are a primary source of homelessness. Maybe that would be more something you would have more information on. But I will say is in Multnomah County, the vast majority of evictions are for non-payment of rent. And so, yeah, I mean, when folks get evicted, whether it's for non-payment of rent or something else, you know, that's a potential result of that. I mean, is that they become houseless because ultimately, you know, like folks have been talking about, not everyone has a support structure, not everyone has family or friends who can take them in, and a lot of these programs that are supposed to exist are, you know, they have really long wait lists. It can take years to get placements, you know, and so, I mean, if I was like in charge of the, I don't know, if I was in charge of something, I mean, I would go to eviction court and just pay like a year of rent for everyone being evicted for non-payment. Honestly, that's something that blows my mind is that there was last year when the moratorium was lifted, there was a case where a tenant asked the judge, I heard about a program that, you know, could keep me from getting evicted, because at the time, if you applied for rent assistance, then your case would be stayed for 3 months while the application was processed. And the judge told that person, oh, well, I can't give you legal advice. Like, and guess what? That tenant was evicted. Like, so that's the system. We think that's a great system that our judges aren't able to tell tenants, hey, by the way, if you just literally fill out this application and give me this letter saying you filled it out, you can't be evicted today. And everyone, you know, who qualified for the rent assistance got it eventually. It took a long time, but I mean, why? I mean, that seems like when I'm hearing how expensive these beds are, how much does it cost to pay a year of rent? Exactly. You know, or if it, you know, however long the list is. I mean, that's a good incentive to maybe make the lists go by faster, as if maybe the county was on the hook for paying people's rent until they, you know, got some alternative bar they could, you know, actually afford their rent. That would also be great.
Yeah, I was just looking up, so in June of the evictions, 994 were for non-payment of rent. In May, 844, this is in Oregon. In April, 776. In March, 740. So you just try to imagine what's next for anyone who's evicted for non-payment of rent. It's not going to be very stable. And then you have people that are maybe lose their housing for through a more informal process. I mean, it's a little bit of an aside, but when Kevin was talking about how we haven't grieved COVID,
And I was just thinking about how powerful it is to be together. I was so excited when I found out this was in person. Like, it's electric to do another human. We lost in this country 1 million people. I mean, we lost more than 1 million people. And you know what? A lot of those people, you know, we've had elders that live with their kids, or there's all kinds of family structures. I mean, at streamers we hear again and again, you know, one of the precipitating events is a parent died. And as an adult, they just start piecing it together. So it's another kind of eviction, right? Like, it's just, everything falls apart and you end up on the streets. I just want to say one more thing on those lines is that, you know, the Metro Housing Tax Measure in the Metro region has these long-term housing vouchers. There's a legendary housing organizer named Bobby Weinstock, excuse me. He's with the Northwest Pilot Project. He dreamed this up, a kind of global Section 8 voucher. These are really exciting. And I want them called Bobby vouchers, I want him on. But that is that notion, actually. That's what we should just do, is just make sure that people don't, you know, adapt the voucher. Because otherwise they're on a list for 6 years, 8 years, whatever it takes.
The other exacerbating problem about being evicted is you've lost your first and your down deposit to get into another place. So that even if you could manage to cover the rent, being able to come up with all that startup money to get into housing, for most folks, it's just not going to happen.
And restitution, don't forget that. You have to pay your landlord's legal bills.
It's on your record.
And you can't get housing anyway, so you have to fix your record also.
All of those. I want to say something first, and I'll come to you, Ira. So, Kai, you may remember this, but back, what was it, 5-ish, 6 years ago, myself, Charlie Hales, the mayor, Gresham at the time, Multnomah County Commission, and eventually Clackamas County Commission were trying to solve the issue around the Springwater Corridor. It became a big thing. And we had this whole RIDA organization with organized, you know, people helping, all this stuff. The only valid, useful thing that came out of 6 months of my life had nothing to do with me. There's a guy named Mahit Brown.
I knew that all the time.
Really studied. He and his team, I believe, interviewed roughly 25% of the people living on the Springwater Corridor. When you are interviewing 25% of anything, that is valid scientific data. You know that that's accurate. So what he learned, and you may remember the numbers, hard numbers better than I do, but ish, most of the men that were living on the corridor, somewhere in the high 80s, low 90s, were there because their incomes had ceased to keep up with their rent. 80 to 90% of the men. 80 to 90% of the women were on the corridor because domestic violence. Domestic violence. In Clackamas County, we have exactly one shelter for domestic violence. It's pathetic, and it's way oversubscribed. There are people on waiting lists, and that is not something you can be on a waiting list for. Right. That does not work.
And the other finding I always drew from that seems to be like 70% were from the surrounding regions. When people try to say, "Oh, everyone's moving here for the services," I mean, that's kind of
Yeah, they literally could practically point to the last place that they were housed. Annually. All right.
Well, I'll use my teacher voice too. So my name's Ira Herbs. I run the Political Action Committee for AFT Margin, and we interview. Thank you. One of the questions I started asking candidates, because I just got tired of hearing people say, well, if we can just find the money, we can do X, Y, Z and solve all of our problems. And so one, I said, you find the money by taking money away from some other needed program. I said, we know where the money is. There's 1% of our population has 70% of the money. There's no will. Can you find the will to extract the money from those people through appropriate taxing structures, which we lack in the state of Oregon? So I would like to ask you all to not let these rich motherfuckers off the hook and make sure that you have an opportunity to explain to them the homeless problem and the basic story. Thank you.
What does AFT stand for?
American Federation of Teachers.
Oh, okay.
Thank you for asking.
It's a union.
We're in here.
Professionals.
Please.
No, stop that.
Anyway, yeah, we have support staff, K through 12. We have a couple of daycare centers. We're primarily focused on secondary ed. We have 17,000 members in the state. There's 3 other AFT affiliates that are in healthcare fields. There's about 65,000 of us. So when we join together, we have a pretty good voice and they listen to us. Yeah, I just want to let them know what's going on out there.
All right. Let's see. Let's turn back to the questions that were. I think we answered the first one, which is why so many kids now? Okay, we'll get to you. We got okay. We'll do one here. So of all these questions, you guys, you rather which one do you want to answer the most?
4. I want to answer 4 of them.
That's a good one. I like that one. No, that's 4. Excellent. Do you see a model? Do you see a model elsewhere, like Amsterdam, that Oregon could emulate? And I like this question too, because for those of you that don't know my history, I used to be a National Geographic photographer, and I saw societies all over this planet that frankly function better than this one. Healthcare being a big piece of that. I experienced the healthcare in countries that we would consider beneath us. And it was better healthcare, not that the doctors were better. They were good doctors, just like our good doctors. The nurses were good nurses, just like our good nurses. But there were no questions asked about my ability to pay when I walked in the room. There was no forms to fill out. There was no cash register. There was not even a credit card machine. You walked in, you were taken care of, and you walked out. That's what civilization looks like. So, I think it's a good question.
So, I wanted to, so this is a question I asked the health director of this. I asked him this last week. I said, in this $15 billion a year state agency and all its thousands of employees, who are the top 3 or 4 clinical minds at Oregon Health Authority on the topic of psychosocial rehabilitation for, there's the word again, severe, persistent, and mentally ill consumers? His answer is, I have no idea. I have no idea. People are familiar with, and I'm not such a big fan because it makes a lot of creepy spy technology, called DARPA, Defense Advanced Research Project. I asked him, I don't know if you've been following the federal press about HHS and NIH and people talking about, we need a HARPA, a Health Advanced Research Project. And I said, where does innovation, where does novelty, where does risk, and what you're doing to the 200,000 Oregonians who are receiving behavioral services, where is that department? Because I want to talk to those people, because I see what the status quo is, and I see that it's important that these larger CMHCs that have 2,000 employees, that we don't want to cut their budget because it's a jobs program and they're doing good work. But where does innovation and novelty take place? And he said, well, I don't know that either. I'm not really sure if that's our responsibility as a health authority. But so one of the, in the area that I work in, as a person who's previously struggled with psychosis and schizophrenia and nervous voices, I'm particularly interested in what are other places doing to move the needle to help support the emancipation, the independence, and the growth, the psychological growth, maturation of the individual who struggles with schizophrenia or severe depression. And it's taken me 20 years. In
2001, Kids Soccer added $5,000 to my grant that I got. Sent me out to New Hampshire and said, we are looking at a project out there called Peer Respite. Individuals that have lived with mental illness are supporting people in a cottage facility who are struggling and don't want to be alone, but don't meet criteria and are not applicable. It's not appropriate for them to be in a hospital bed. They don't need clinical attention and they don't need to be in a locked ward. So 20 years ago, he sent me out there, finally, in session 2021. The state of Oregon said, we will right now fund 4 of those to be geographically located across the state of Oregon. Why that's important, and the doctor will probably tell you this, there's a significant amount of people going to the emergency room tonight, going to the psych hospital and saying, please let me in, and then saying, you don't meet involuntary criteria, so you go home and call the crisis line. We have never recognized that the 60% of those people who are turned away, that they still might have some needs. And if we can attend to their mental and emotional needs currently choice-based before things get completely gone and out of control, they may become better, knowledgeable consumers of pulling at what threads help meet their needs. And so one of those things is called Peer Respite. Lots of other states are doing it, and we're starting to do it now. Secondly, and I don't know if it's in one of the northern European countries, and it's a take on, and the doctor probably knows about this, in America we have what's called assertive community treatment, intensive mobile teams that come out that support you, and they have less, like your caseload is regularly be 80, maybe you have 15 people on your caseload. And some of that is very, very positive. It helps support people who are time intensive and high utilizers of services. In this northern European country, they've been studying what they call open dialogue. It does a little tweak on that, where as you work with a treatment team, you make contact. So say you're the crisis worker, and I say, Mark, I'm having a psychotic episode, I'm depressed, or whatever. You turn into my guide, and the first person I make contact with on that team is then I'm assigned to a treatment team, and you follow me as an advocate, as a supporter, and everything is above board. All my clinical notes, all the discussions with the family. And they have moved a reduction of using a significant amount of neuroleptics, hospitalizations, and the quality of life for these people who struggle with these severe disorders has gone down dramatically. And we're trying to get some of the states in America to look at those projects and say, why don't we do this? It's humane and it meets people's needs and keeps them out of the emergency room and promotes a better quality of life. So open dialogue, Finland, is pretty amazing, the results they've had doing that. So I just wanted to put a plug out there. All I talk about is how we work with people who have psychosis. That's all. That's why I'm good so it happens.
So Kevin, I think I first met you in like 2016 when you were doing there was this Slum Report records about Unity before.
Yeah.
And so, when I see this question, I think about Unity because I feel like Unity was supposed to be like something that was modeled after successful things elsewhere, but then like the people in charge were like, well, we're Oregon, we're special, so we're just going to take like something from here and something from here and something from here and then put it all together. Like when you talked about, or someone talked about earlier about the congregate setting and how damaging that can be in crises, I think about PES.
Yes.
And when I first did that breakfast in 2016, this was over a year before Unity opened, heard about PES, which is the psychiatric emergency service where there are 50 recliners in a room together. As an EMS worker, I was like, that is not going to work. That's the worst thing I've ever heard in my life. And so that's the kind of thing where I think, okay, how can we ensure that someone doesn't mess with it? These models at work, can we just do them and not be like, well, we're Oregon, we're special, so we need to do it the Oregon way. Because PES, I transported the first patient to PES, and it's been shut down multiple times by the state for being so unsafe. I mean, it's literal disaster, and I think actively harms people, honestly.
Absolutely. It's a traumatic setting. Who wants to be struggling with severe suicidality, paranoia, and here you are in an open bay with 40 or 50 recliners, you could reach out and whack the guy next to you. You can't have your family member there. It's a fishbowl.
What they say is it's clinical efficacy with just an excuse to reduce staffing costs.
Yep.
Just an awful, and the nervous systems of people who are jammed into that, it's awful.
And it still costs a lot.
Yeah, I don't know, I don't know how much it costs, but I.
$2,000 a day.
Oh, there you go. I helped organize the behavioral health assistance there, and I mean, when it's, it's, again, a job where these, a lot of these folks have advanced degrees and are, fighting with, to get, they don't even make $20 an hour,
Okay.
So, Alli, one thing that I think should be mentioned about unity is the fact that it is run by legacy health systems, a not-for-profit, don't be fooled, not-for-profit, okay, health insurance and provider system with help from Kaiser Permanente, a not-for-profit health insurance and provider system, and I don't remember who else, but
it's an unholy alliance between all of them except for Providence, because Providence is special.
They all collapsed their beds and all went in on the.
Yeah, by the way, they didn't add any beds. It actually
You're
removed
telling
beds.
me that's not about money? I spent 20 years working for Kaiser Permanente. I worked for Trillium, the CCO, the folks health net and all that shit. It is about money. It is an unholy alliance. Yes. Absolutely.
So, many of you may or may not know this, but back when Richard Nixon was president, before that, hospitals were not allowed to make profit. They were all literally, not in name only, non-profit. They were buildings in which healthcare occurred. People who worked there were paid well for their jobs, but there were not people making money simply off the fact that they had invested in a hospital. That is literally an unholy alliance. So somebody out here had a question apparently, and I didn't see a hand. Go.
So I'm Laura, and I work at Legacy, but also I speak for myself only and do not represent Legacy anywhere here. But here's a couple things I would love. One, update Oregon's program for supporting low-income Medicare beneficiaries so that we no longer have this transition when people get Medicaid as people under 65 or without Medicare. They are able to qualify for full Medicaid supports, which are incredibly important for people who get them, if they earn up to the full Medicaid limit, which is $1,300 something. And as soon as they turn 65 or get Medicare services, their secondary support is cut if they make more than $731 per month or something like that. And if you try to make it on $731 a month in this climate, and you have to pay co-pays and co-insurances for mental health care, it doesn't happen. And so if we could make our system run in line with other systems in this country that function better and provide support up to the 100% federal poverty line, that would be wonderful. Number two, I dream of a time when I, as a social worker in the healthcare system, can say, no, I can't help you walk in that journey to the housing place to start getting involved. But here is a person, their name is, they will walk with you on this journey to apply for the housing brochure, to walk in and see and go and knock on as many fucking doors as it takes to get the services that they need. Because people, the idea that we have in this country that people are able, without any assistance, to complete these forms and complete these processes that are complex and written by legislators, there's no idea how these functions in the society
It is inhuman what we expect people, all people to do. Also, number three, what works for people with psychosis works for all people. So let's try to use the things that work for people, and they will work for all people. Unless they qualify for Medicaid physical community support. So there are two pathways. There's an age to disabled pathway and also a community support. So if you meet the very intensive qualifications to, can you shower by yourself, then you have a higher financial limit allowed. But if you don't meet those very intensive service requirements, you don't qualify. So that's very difficult for people.
Please connect with Ryan. We're going to want to pick you, Ryan. Okay. So, we have surpassed the time we said good evening. Thank you, Craig. Please give a very warm round of applause for our
And also to our upcoming legislature.
So, we just picked apart just a little bit one of the major issues facing our society right now. We touched on many, but really it boils down to this one really horrific thing that shouldn't exist in the richest country on the planet. There should be no houseless people in this country. There should be no people in this country who do not receive the health care they need, the mental health care they need, straight up. As Ira very poignantly pointed out, there is no lack of income, no lack of funds to pay for those things. What there is a lack of is political will. That was also pointed out, the reason for that is our very broken system of how you get elected and who you have to get money from in order to get elected. Right? So, we need open primaries, we need ranked choice voting, and we need publicly funded elections. That will help to start to fix the problem. But we need to tax the rich. We need to stop sending money to Wall Street. And we need to tie the minimum wage to the cost of housing. Think about that. So, Ryan and I are putting together a tranche of bills. One is to create a state bank. One is to tie the minimum wage to the cost of a single family or one bedroom apartment. So that it never, we do this thing, right, where we go, okay, we need $15 an hour, and by the time we get to $15 an hour, we need $25 an hour, right? And we keep doing this thing, and as a result, thousands and thousands of people are homeless. We need to tie it permanently to the cost of a one-bedroom apartment. Therefore, it never will become something that you can't afford to live. And lastly, we need a millionaire's tax. Here's what happened in the last downturn. The banks stopped loaning money. The builders stopped building. The trades moved out of the state. So, two things occurred right then. People were still moving to the Portland metro region, but we weren't building more housing. So what did the cost of housing do? And then, when the bank started loaning money again, and we started building again, because there weren't enough people in the trades,
What did the cost of construction do? So, our concept is that with the millionaire's tax, we fund the state bank. When there's a downturn, the state spends money building affordable housing. We keep those people employed, doing the work that they're meant to do, solving the problem we have. So, that's just one thing, one piece. But for the discussion this evening, we think that that's an important part of the solution. There's a lot of work to be done around mental health. We're in conversations with Rep. Noes, we're in conversations with other people. We're hoping to pull together other conversations about that particular issue because it is broken. Every social services worker that I have spoken to working in that realm describes it as utterly broken, and some of them have come from out of state and they used to work in other states that Oregon probably looks down on, and the system there was far superior to what we're doing here. So there is no place to go but up in that realm, right? So we're going to continue to do work on that as well. And then, as many of you know, my reason for being in politics is climate. If we fail to get that right, if we fail to solve that problem, none of the rest of this is going to matter in 50 years. None of it. So we will be having another one of these very interesting panel discussions, hopefully in the near future, addressing that particular issue.
Steph, to interject that, Steph, make sure you sign the signage up front so we can email you about that one.
Yeah. On your way out, there are little, plug your ears, Kaia. There are little brochures for several people who are running for office in our realm. Jamie McLeod Skinner, critical race. Libra Ford, critical race, elected. Sonia Fisher, Catherine McMillan. You'd all like to see your election results, sometime in the same year that the election occurs. He'd be an important one. And our remit forms are out there if you care to help us continue to employ Ryan so that we can do the work that we're doing predominantly. And I will be honest, my race is a slam dunk. It's pretty much an assured thing that I will be the state rep. But what we were able to do in the primary, even though I had a real race in the primary, was we were able to use our campaign muscle for those other people. And we kicked the ass of a 10-year, well-financed, incumbent asshole. And we need to keep doing it.
By the way, that's Kurt Schrader in case anybody.
That is Kurt Schrader. Vanessa. We'll be knocking doors for Vanessa. We'll be knocking doors down in Salem. There's a couple of races. Roz Mason out in the sort of the Gorge direction. Even Janelle Bynum's in a tough race this year because her district changed so much. She was pushed deeper into Clackamas. It's a dangerous race for her. She is somewhat more conservative on some issues, but she has kicked ass on police accountability issues over the last 2 years. She has got a force to be reckoned with. So there are some very important races, and the only way that we can help them is if I have a strong campaign team to do that work. So let your friends know we need financial help to do that work. Not to put me in office, I will be there. But I need teammates. I need people at all levels of government, above me and below me, and as my teammates in the legislature, so that we can pass those 3 bills I just talked about and many, many more that are so important to our society. Thank you so much more.
And please take food. Please take food with you.
Well,
Well,